live from the Bommarito Digital Studio.
Hey everybody, happy Friday to you. Matt Chambers coming to you from, well, not the KMOV studios, but my living room, which is the makeshift studio. Isn't that the way of the world right now? Laura Hediger's got the day off today, and Kent Earhart has already put in his time for today, so I'm afraid you're stuck with me. Sorry about that. And my next guest, which I'm really looking forward to speaking with. You might have seen Laura Hediger conversing with her as we broadcast Great Day St. Louis through the airwaves earlier this morning. Dr. Becky Lynn joins us from Evora Center for Menopause and Sexual Health. Dr. Lynn, nice to have you here. How are you?
Thank you. I'm good. Thank you for having me.
Well, I'm excited about this conversation, and most of all, I think I'm excited maybe to help some folks that might tune in for this live Facebook segment today, because the goal, your goal, of course, is to try to help women answer some questions, make them realize that they're not going this alone. And I just want everybody that's watching this stream for a moment to think about all the important women in your life. I know Mother's Day just came and went not that long ago, but think of your moms and your sisters, your wife, your cousins, your aunts, who tend to play a lot of these things. I think, Doctor, you would agree, pretty close to the vest. This isn't something that, I heard Laura Hediger today describe it as taboo. That feels like an appropriate label, although really it shouldn't be. We have to be very open and honest about these kinds of sexual health issues, don't we?
Absolutely. You know, I think that, we just learn from a young age, oh, keep it quiet, hush, hush, don't talk about sexuality. Yeah. But women's sexuality is just as important as men's sexuality. And if you think about it, even though we keep it quiet, what do we do on this earth? Where it's like food, shelter, and sex. That's the basics of things that we need. And, and we don't teach a lot about what is normal. So many women will come to see me and say, is this normal? Or they're, terribly worried that something's wrong with them. And then my answer is, oh, that's normal. And they didn't know that because, where do you learn anything about sexuality? Your friends, the internet, you don't really get your information from a perfect source. So, part of what I like to do is just educate in a way and explain this is what's normal. And, a lot of things we worry about are just plain normal. And when they're not,
I wanted to get that out
them.
in the, right, exactly. And I wanted to get that out on the table first and foremost, because again, one of the beauties of these Facebook Lives, these GDXLs, Great Day Extra Live, is the interaction with you guys watching from home. So don't be shy, don't be embarrassed. If you want to talk about a friend that's dealing with issues, that's totally fine. We understand. I put my big boy pants on today. This is what the doctor does every single day. So we're going to have a very honest and open conversation about this. Doctor, I want to get to know a little bit about you first and foremost. What's your background and what brought you into this line of work?
So I'm an OBGYN. I don't do OB anymore, so I guess I'm just a gynecologist. And the way that I got into this line of work was that women would come to me with sexual concerns, and especially right out of my residency training, I didn't have the skills to take care of them because it's not taught in residency or medical school. But when I went to practice, I would hear things like, I have no libido, or sex is painful, and I didn't feel well equipped to handle it. So I went out and sought some more education, conferences, ISWISH, which is the International Society for the Study of Women's Sexual Health. And I learned so much about sexuality sort of after training. And then I had an answer. And so then my partners began referring their patients to me, and it just sort of fell in my lap. And I'm not embarrassed to talk about sexuality, and some people can be quite embarrassed, both healthcare providers and patients. And I really enjoy doing it because it sounds so trite, but I enjoy doing it because I can really, really help people. Because just sex is so important to the relationship and your happiness, your overall happiness, your relationship with your partner. And when there's problems in that relationship, there's a multiplier effect. So it spills over into the family. Sometimes it leads to divorce and the breakup of the family. So I really feel like I'm really helping people.
So, Doctor, I'm intrigued by this feeling of uneasiness that a lot of people have about talking about this. And you, as an expert in this field, you have to break through that. So let's start with that. How do you get these people to be so at ease about having an open conversation with maybe somebody they just met, you know, a half an hour or 60 minutes ago? How do you break those walls down? Because without doing that, as a physician, you can't really practice and treat these people.
Right. So definitely, I am not judgmental. You know, whatever you say can't faze me. I've heard it all before. Just say it out loud. And I think just naturally pretty easygoing. I'm comfortable talking about it myself. I think if the provider's not comfortable talking, then it sort of raises the tension in the room. But I don't know. I think I'm kind of easy to talk to.
I would say that goes a long way, right? So
it does.
Again, as we're doing this live on Facebook, we want your questions, we want your input, and I'll try to get to some of those in just a little bit. So what are the most common kinds of issues, complaints, concerns, problems that you deal with, doctor?
So in the sexual realm, I also do menopause, but in the sexual realm, the two most common complaints are low libido and painful sex. And I would say that those make up low libido 40%, painful sex 40%. And both of those are pretty complex issues. There are many, many things that can contribute to low libido. It's not always just your hormones. We love to blame everything on our hormones, but things like depression or anxiety or, you know, cancer or painful sex leads to low libido, you know, or even what your parents taught you about sex, or, you know, not to put any blame on anybody, but, you know, sort of your own belief system. There's so many things that play into low libido. It's definitely not just your hormones. And same with painful sex. There's so many different things that can cause it. It can be due to vaginal dryness around the time of menopause. It can be due to things like endometriosis or interstitial cystitis, which is painful bladder syndrome. There's so many different things that can cause painful sex that I think it is important to see a specialist so you can really get to the right diagnosis. And once you get that right diagnosis, then you can get appropriate treatment and get, you know, your sex life back on track where you want it to be.
Doctor, you mentioned an important word there, and that is the word hormones. I think now more than ever, it's seeped into the mainstream, hormone therapy, hormone treatment, almost to the point that from an outsider's perspective looking in, you might think that that's kind of the de facto treatment right now. That's sort of the first thing everybody reaches for. You say it's much more complicated than that, right? That can be one solution for a particular group of people, but that's not necessarily a fix-all, cure-all. It's not necessarily needed for everybody, is it?
Right. So, you know, one thing I'll see sometimes is a woman will come in and she got some testosterone, right? Because especially in postmenopausal women, their testosterone is much lower than it was when they were younger. And that's one contributing factor to sex drive. So maybe they got put on some testosterone, but it didn't work. And, you know, if you are in a horrible relationship, all the testosterone in the world is not going to give you sex drive for that person. Or if you are incredibly depressed, or let's say you have a chronic illness that you're dealing with, you know, for women, you know, sex goes to the bottom when you have other issues in your life, whether that's maybe you're going through treatment for cancer. Probably not going to feel like having sex, and testosterone's not going to fix that. So yes, there's definitely a role for testosterone in postmenopausal women, but it's not like, oh, just the answer here, take your testosterone.
Right, no doubt about it. By the way, if you're just joining this GDXL in progress, first of all, welcome aboard. Happy Friday. Just to reset the table, we're talking live right now with Dr. Becky Lynn, who's from the Evora Center for Menopause and Sexual Health. And Dr. Lynn, I want to dive a little deeper into something you just mentioned, talking about sex drive and hormones. In your world, you really have to be attuned to the physiological, right? The physical processes of the human body and what might be able to help that return to a normal state. But the psychological side of this too, because you talk about something like sex drive is a great example. Some of it's going to hinge on what's happening internally, and some of it's going to hinge on what's happening externally. So are you able to address in your practice both of those facets?
Yes. So I'm also a certified sexual counselor, so I can really bring in the relationship counseling to my practice. And when somebody comes to see me, they have an entire hour with me. So it's, my practice is not, okay, you wait an hour in the waiting room and then you see me for 5 minutes and then you're out. That is definitely not what I do. I really spend a good hour with you on your initial visit and go through the relationship, go through, physiologic factors, and I address it all. Because if you only address one aspect, you're not gonna fix the issue. So so it's, and the other thing is, let's say you had, low libido, but you didn't have any relationship problems, you weren't depressed, there wasn't anything psychological going on, but now you have low libido, and whereas you had a good relationship before, that puts a strain on the relationship, now you're fighting. So it's like, it's very hard to separate them out. They really are intertwined.
Of course.
Mm-hmm.
Sure. Yeah, it's part of that relationship dynamic, of course. Yeah. So it makes sense that you would address both. And I think that would be very comforting to the folks that seek you out for help, that you can handle that psychological and that physiological side simultaneously. We've talked a lot about sexual health. I'll deviate for just a second on a semi-tangent here, because menopause is certainly a part of a woman's sexual progression and change over the years. I'm sure you deal a lot with menopause, with hot flashes, with night sweats. What is the latest in that world? And what are some of the most common symptoms, problems that women come to you with in terms of menopause?
Yep. So we all think of menopause as just hot flashes, just night sweats, that's it. But there's so much more that happens around the time of menopause. So it's hot flashes, night sweats, weight gain. Women, when they lose their estrogen, tend to deposit fat around their middle instead of hips and breasts and butt. So weight gain, sleep disturbances, excuse me, even if you're not having hot flashes, joint aches, depression and anxiety are really common around the time of menopause. This is a time when women's children are growing up and leaving the house. Maybe not today, they're not leaving the house, but they're moving away, and it can be sort of, now what's my identity? There's so much more that goes into it than just hot flashes and night sweats. And also, I didn't mention that low libido and painful sex go along with menopause also. Sure. And, as far as hormones go, there was a big study in the early 2000s called the Women's Health Initiative that really scared everybody off their hormones. This was a big study funded by the NIH, and it looked at one formulation of hormones called Prem-Pro or Premarin. And that study found that women on hormones had an increased risk for breast cancer, blood clot, heart attack, and stroke. In women on Prem-Pro with progesterone and estrogen. And it was all over the news media. Then everybody stopped their hormones. Hormones are bad. We kind of got away from that. But that was almost 20 years ago. And since then, they have looked at that data and continue to collect the data. And they've broken down that data into age ranges. And they found that women between the ages of 50 and 59, that using estrogen or estrogen and progesterone together actually protects you against heart attacks, protects you against overall mortality, and it doesn't increase the risk of stroke in that age range. So, but I feel like that hasn't been picked up and isn't as well known as what we learned 20 years ago, because it was such a big deal. So how we look at hormones, or how I approach hormones, is they can be very, very helpful in the right person at the right time. So they're not for everybody. It depends on your other medical problems, but in that right person at the right time, they could protect you against heart attacks. And the number one killer of women is heart disease. It's not breast cancer, though we're all really scared of breast cancer, but the number one killer of women is heart disease.
Yeah, and 20 years is an eternity in the medical profession, among other fields too. You talk about data that's 20 years old. Think of the advancements. Think of the changes, the new discoveries that we've made in that time. I want to talk about how your practice, your business, is a little different than maybe what the average patient or the average consumer is used to. You are, in essence, a concierge healthcare provider. Explain to people that are watching right now that may not be familiar with that, what that's all about. How does that differentiate you?
Sure. So I used to work in a big healthcare system, and I felt that I you know, and it's just the way that healthcare is. This is just how it is out there. But I felt like I had a lot of pressure, see as many patients as you possibly can. And I was an employee, so, you know, that's what my boss wants us all to do. And I just didn't have all the time that I needed to be the kind of doctor that I wanted to be. I like talking to people. I want to spend time with you. I don't want to feel like, okay, you came in and now tell me your problem and you're only allowed one problem and then you have to go because I've got all these other people waiting. I didn't enjoy that. I really, it sounds so trite, but I really, really like talking to people and helping people. And so what I decided to do is open a concierge practice. And this is a practice where I don't accept insurance because when you go with the insurance-based model, in order to, you know, keep afloat, you have to see a lot of patients. So I decided I would rather limit my practice to fewer patients, but then give my patients all the time and direct service that they need. So when my patients have problems, they call me. They get me on the phone. They don't have to call and get a call center or somebody who doesn't know their history, doesn't know them. And there's nothing wrong with that model, you know, which is how most health systems are, but it wasn't working for me. So now, because I don't take insurance, patients do have ways to get their visits paid for. They can always submit their visit to their own insurance, or they can use a health savings account or a flexible spending account to get their visit paid for. And we help them along the way. We provide the documentation that they need to get their visit covered. But by me not accepting insurance, all of my resources go directly to my patients. So I really love it. I feel like I can be the best doctor I can possibly be because I know my patients. I'm there for them. It's wonderful. I'm really happy in what I'm doing.
Dr. Lynn, when we have these conversations with professionals here on GDXL, I always try to put myself in the shoes of someone that might be watching and wants to ask a question. What would they ask you if they were in my position? So on this point, I want to be really, really clear because I can almost hear in my head people saying, well, wait a minute, I have a couple of follow-ups about this pain issue.
Sure.
It is a different model than a lot of us are accustomed to. I just want to be clear. What you're saying is that just because you don't accept insurance and process that insurance, et cetera, does not necessarily mean that an individual's health insurance plan might not cover your services, right? And you're willing to help them submit that paperwork, right, on their behalf.
So they can submit the paperwork. And also there's an app called Reimbursify that's actually really helpful at getting people reimbursed. So it definitely can be done.
I'm going to take this, Doctor, as anecdotal evidence about what we talked about earlier, how everyone is attuned to this, everyone is interested in this, and yet it's still a little taboo. There's still that little wall to climb over. Lots of people are watching. I've seen lots of people join the conversation. Nobody wants to ask a really personal question. But here's how I know that it's resonating with people is because I see a lot of people, and I won't name any names. I don't want to embarrass anybody, but I can see on my end of the stream that a lot of people, almost all women, by the way, are sharing a link to this stream. They're sharing this stream to all of their Facebook friends because, again, they probably have a mom, a sister, a spouse, what have you, that's dealing with some of these issues. I don't think there's much question about that. This is part of a woman's life. It really is exuding through the ethers here, Doctor, that you love what you do. I feel like you're in the field that you were meant to be. Would you say that's a fair assessment?
That is a fair assessment. Absolutely.
Well, that's good. That's good. And we're happy to have you on board. Let me scan one more time just to make sure that we haven't had anybody super bold jump in. We've got in the neighborhood of 50 people watching right now. And again, if you're just joining us, let me reset the table just a little bit for everybody's benefit. Dr. Becky Lynn joins us live here on GDXL from the Evora Center for Menopause and Sexual Health. We've covered everything here from sexual problems as women age to issues with menopause and natural transformations that a woman and her body go through in their lifespan. What's normal? What's not normal? Maybe I should ask that question, Doctor. I haven't really asked that. I think a lot of women tend to experience these changes and think almost as if they're isolated. that they're experiencing things in a way that no one else has. In reality, a lot of women go through these issues too. So why don't you tell us what's normal and what might raise a red flag that you need to seek some attention?
You mean with menopause?
With menopause or with sexual health, either one.
Sure. So, you know, menopause, women get very little education on that either. We always talk about puberty, you know, your 7th grade health class, it's all about how not to get pregnant, STDs and things, but nobody really talks about what happens when your periods go away. And most women, I would say, know hot flashes, night sweats. We all know hot flashes and night sweats happen because they happen a couple years before your periods go away, and they last a couple years after. Some people's last a much longer time. But we all sort of know that. But one thing that we don't know that I see, and this sort of overlaps, is when you go through menopause, your ovaries aren't making estrogen anymore, and the vaginal tissue needs estrogen to function normally. So postmenopausally, people can develop vaginal dryness. But the thing is that it doesn't show up for 5 years. Like those changes to the vagina are slow. They take place over time. So around 5 years after the last menstrual period, approximately, all of a sudden, you know, they have dryness. That leads to painful sex. They're not lubricated, and they're thinking, what's wrong with me? And the partner says, what's wrong with you? What, you know, and many women don't realize that's what happens when you go through menopause. But because that symptom is so far removed from when your last period was, we don't always think about that. Sure. And women are afraid to ask about it, you know, or to say anything about it, but there's excellent treatment for it. You know, we often use low dose vaginal hormones, which really restore the moisture, the elasticity to the vagina. So yeah, you don't have to live like that.
I think that makes perfect sense. You're right. 5 years is just a long enough period of time for most women probably to not make a mental connection between their last ovulation, their last period, and this sudden dryness that they're experiencing too.
Yeah.
I want to circle back, change gears just for a second about the nature of your concierge business. You understand that not everybody, especially right now, right? These are difficult times for everybody. It's hard to find someone that hasn't been, at least on a small scale, financially impacted by what's going on in the world right now. You understand not everybody has the ability to pay out of pocket for healthcare. So you have these giving back to the community days, or this giving back to the community program. I want to hear a little bit more about that.
Right. So, you know, when I decided to go to the concierge model, I realized not everybody can afford to pay for care. Not everybody has those circumstances. So I have each month 2 days of giving back to the community where I will see anybody and everybody. You can pay me whatever you feel is appropriate, from nothing to baking me chocolate chip cookies to the winning lottery ticket. I mean, not really, but you know, it's one of those days. That hasn't happened yet. Darn. But you know, I realize that the concierge model doesn't work for many people who have these issues that still need treatment from a specialist. So those are the giving back to the community days. They're the first Thursday of every month and the second Tuesday of every month. We do those.
I think that says something about your spirit, about your heart, and about your compassion as a clinically trained physician who's still dealing with this every day. That you're, you know, that it's about more than earning a paycheck and more than establishing a practice. It really does sound like you want to get out there and help the community. And I bet, despite the fact that no one's willing to chime in, I know a lot of people are watching right now, because I can see the numbers. Let's make sure that everybody knows how to get in contact with you. What's the best way for them to reach out to you? So our office phone number is
314-934-0551. So I'll say that one more time, just in case. 314-934-0551. Or you could go to our website. You can schedule directly through the website. The website is Evora, which is spelled E-V-O-R-A, then by B-Y, doctor, which is D-R, BeckyLynn.com. So Evora by DrBeckyLynn.com is the website. But honestly, if you Google Becky Lynn Evora, it'll pop up. and Evora is EVORA. And that's how you can reach us.
Well done. Very clear. I'm going to repeat it so I can do my part. 314-934-0551. 314-934-0551. And the website is Evora with a V as in Victor, Evora by Dr. BeckyLynn.com. And that last name Lynn is spelled L-Y-N-N. Doctor, it's been a real pleasure to talk with you today. Is there anything else I should have asked you about that I didn't? Because, you know, I am a guy. You got to bring yourself down to my level. I'm trying to fill Laura Hediger's very big shoes in this conversation. But any parting words for those people that might be watching and maybe want to reach out?
Well, first of all, I thought you did a fantastic job bringing up subjects, you know, that are, you know, that apply to women. So kudos to you.
Well, thank you.
No.
I'll take that as a gold star. Thank you.
Yeah, and I just, you know, wanted to say we're really easy to reach. We're pretty easygoing. I do follow the evidence-based science. I stick to recommendations. You know, I really believe in science, and I treat my patients accordingly. So give us a call, and we are so happy to help you.
Again, I won't name names to protect the innocent here, and I don't want to embarrass anybody, but now people are starting to jump in. One woman says, I will reach out. I need to discuss how to deal with symptoms. And here's another, and I really appreciate this remark because I bet a lot of people watching are in the same boat.
Yeah.
She says, hi, Matt, enjoying the program, but boy, I passed this stage of life a long time ago. I needed this information 25 years ago. So think about that for a moment. And again, think about how much has changed in this field over the last 10, 15, 20, 30 years. There are treatment options out there that you might not even know about. So reach out to Dr. Becky Lynn. And this is the kind of thing that could really make a serious change in your life, isn't it?
Yeah, yeah. And even if you're past the menopause, you know, you can still end up with sort of painful sex. There's still things you can do even when you're past the menopause. So, yep.
There you go. There you go. So never too late to reach out, I suppose. And to everybody else watching that was just watching from the sidelines, I appreciate it. Sean said good morning. Tammy said good morning. Lewis checked in. Julie said good morning. So, Doctor, the folks are out there, and we appreciate the candid conversation. And we, again, encourage everybody to reach out to you if they have any questions or concerns in the realm of women's sexual health or menopause or what have you. And I would encourage you, by the way, if you want to share this Facebook Live with other people in your family that might be going through some of these struggles, having some of these issues, share it. We have to have an open conversation about this. And if you want a miniature version of this, you can go to our website, kmov.com/greatday, and check out the 3 to 4 minute conversation that Laura and Dr. Lynn had on Great Day St. Louis a little earlier this morning. Dr. Lynn, I think that just about wraps it up for us. Thank you again so much for being here. We appreciate it. Stay safe, stay well, and keep doing the good work that you're doing, okay?
All right. Thank you very much. Do I go?